it was called the Tranquilizing Chair. The name sounds peaceful, almost like a 19th century spa treatment, but for the patients at the Pennsylvania hospital in 1811, being tranquilized meant being strapped into a device that modern human rights groups would call a torture chamber. The chair was the brainchild of Dr. Benjamin Rush. He was the king of heroic medicine. Rush believed that madness was caused by an overexcitation of the blood vessels in the brain. He thought if he could just slow your pulse and stop your body from moving, your mind would magically reset. Look at the design, the straps. Your arms, legs, and torso were bolted down with thick leather straps. Zero movement allowed. The head box. This wooden frame locks your head in a fixed position. You couldn't even turn to see who was in the room. The sensory deprivation. In some versions, a blindfold or a hood was added. Some patients were left like this for days. No sight, no sound, no movement. Oh, and because Rush was a fan of evacuation, there was often a bucket built into the seat because they weren't letting you out for bathroom breaks. Imagine the terror. Your heart is racing, you're paralyzed by leather straps, and you're trapped in total silence. Rush claimed the chair worked because patients eventually became quiet. But modern psychologists point out the obvious. They weren't cured. They were experiencing learnt helplessness. They were so traumatized and physically exhausted that they simply stopped fighting. To a 19th century doctor, submission looked a lot like health. The tranquilizing chair eventually fell out of favor as asylums moved toward moral management. It stands as a chilling reminder of what happens when medical logic ignores human empathy. If you find the history of medicine as fascinating as I do, don't forget to like and subscribe for more.